to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our recap of the week that was, highlighting 5 important headlines you should know about. Today is Friday, October 10th, and that means just 5 more days until the 2026 annual enrollment period begins. It is also day 10 of the current government shutdown, so we'll start there at number 5. Depending on how long the shutdown lasts and what is included in future legislation to get things up and running, there is one important thing to remember about Medicare benefits, and that is that Medicare telehealth allowances expired along with government funding on September 30th. Telehealth flexibilities were granted during the pandemic and then extended multiple times over the past few years. Bipartisan support for Medicare telehealth benefits does exist. This benefit is just an unfortunate victim of the current shutdown. That means that Medicare telehealth now looks like it did prior to the pandemic. It's been more than a couple minutes since then, so I thought we'd recap those changes. Where your clients are able to get care has changed, as the definition of an originating site has reverted back to places like the hospital, a provider's office, or a skilled nursing facility. Telehealth can only happen in-home for a handful of diagnoses, like in-home dialysis, substance use disorder, and mental health disorders, to name a few. Geographic limitations are back as well. Beneficiaries must either be in what's considered a rural health professional shortage area or a county that's not part of a metropolitan statistical area. Again, exceptions do exist for a few types of care: ESRD, acute stroke, mental health, and substance use disorders, to name a few. Audio-only telehealth support is no longer available unless the beneficiary is unable or unwilling to use video. Provider limitations are also back in effect, so only a specific set of providers can offer telehealth services. Prior to the shutdown, anyone who had the ability to bill Medicare could provide telehealth appointments. Now we're back to a select list that includes physicians, physician assistants, nurse practitioners, clinical nurse specialists, nurse midwives, clinical psychologists, clinical social workers, registered dietitians, nutrition professionals, certified registered nurse anesthetists, marriage and family therapists, and mental health counselors. Federally qualified health centers and rural health clinics are no longer considered eligible distance sites where physicians can perform telehealth services. And for Medicare beneficiaries receiving treatment for mental health disorders, in-person visits are once again required within 6 months prior to the initial telehealth visit and every 12 months after. There have been a few different versions of spending bills proposed over the past 10 days. Those have either extended these telehealth benefits or made them permanent. As I mentioned, there is bipartisan support for them to continue. As of right now, it's just a matter of what the continuance will look like and when any pending legislation will be able to be voted on, ending the shutdown. We will be sure to keep you updated. Until then, we have the link to a few helpful listings of the telehealth benefits for you to review should you have clients calling with questions. Number 4, telehealth isn't the only benefit we are watching during the government shutdown. We are still waiting for a few important numbers in the lead up to AEP, the Medicare Part A and B premiums and deductibles for one, but also the cost of living adjustment, or COLA, from Social Security. Determining next year's COLA relies on Q3 fiscal data, which means we still need the Consumer Price Index report that is due out on October 15th, same day as the start of AEP. Back in 2013, a similar government shutdown caused a delay in the Department of Labor's CPI report, which in turn meant that the 2014 COLA news came out on October 30th. Whether events will play out the same way this time around, well, we'll have to wait and see. We will be getting COLA news out as soon as we hear it. So the best way to make sure you're staying up to date is by following along with our show and keeping an eye on the blog on our website. Both of those resources will be linked in the episode notes. Number 3, while we're on the subject of shutdown, KFF is known for conducting timely surveys. One such study they recently published polled support for the ACA Marketplace enhanced tax credits. Turns out the majority of Americans polled, regardless of political party, are in favor of extending the enhanced tax credits. 78% of respondents would like the tax credits to continue, while 22% would like them to expire. Personally, I'm in the camp of figure it out now rather than the end of the year, just because it's going to be more of a mess for everyone if we have to go back and refigure what works and what doesn't come December, if we've already done that for clients in November. Piggybacking off that at number 2, let's talk about FFM certification and state exchange trainings. We recently updated our blog post information that the 2026 FFM training is now live. And then for the state ACA exchanges with trainings, Colorado, Georgia, Kentucky, Maryland, Pennsylvania, and Virginia trainings are live as well. The only one we're currently waiting on is New Jersey. Again, I'd recommend following along with our show and bookmarking our ACA certification post on the Ritter Blog. We will be updating that information as soon as Jersey goes live. And for our top story, coming in at number 1, we are just 5 days away from the start of the 2026 annual enrollment period. Just a few more days to complete annual coverage reviews and behind-the-scenes work before it is full steam ahead for the next 54 days. I'd like to remind you of the resources we have here at Ritter Insurance Marketing. We mention the blog and our eBooks and guides frequently, but there are so many resources we have to help you inside and outside of the annual enrollment period. We have First Looks, Night School, webinars, Ritter Docs, and our Certification Center, just to name a few. But behind all of these resources, there are real people here who care about you and your success in this industry. If you have questions, please reach out. Whether it's through our podcast email, asgpodcast@ritterim.com, or through your local field rep, sales advisor, or agency specialist. We are here to help and answer your questions, so please reach out. Every annual enrollment period looks a little bit different, and this one's different than others that I've seen so far. But that doesn't mean that it can't be your best AEP yet. That's what we're always striving for, to help you succeed and continue to grow as we're on this journey together, whether it's your first AEP, your second, or your 10th. We are here for you, just one email or phone call away. And with that, in addition to wishing you a fantastic AEP, I hope you have a great weekend. Try to make it a mix of work, rest, and relaxing with the family. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.